Hello, I'm Shoni Philpot, and welcome to our plenary today, where we're going to be discussing transforming digital data into cancer care practice, implementation science in action. Digital technologies promise possibilities to transform healthcare. Often reports about technology-enabled change focus on the large number of existing future opportunities, but less on the realities and pitfalls and how they can be avoided. Too often, technology has simply been layered on top of existing structures and work patterns, creating additional workload for health professionals. We aim today to offer important insights about how to grasp those possibilities and benefits from a group who are furthest along in their digital journey, who together with clinicians have engaged in radical thinking to significantly influence how data can be used to support, augment and influence clinical practice, to improve the system of care for people with cancer. Welcome to the Cancer Alliance Queensland's presentations. Technology presents us with the opportunities to drive improvements in productivity and quality of care. Our focus today is on just a few aspects of a much larger topic, revolving around connections and using big data. We can have a better connected care by developing systems that integrate with and coordinate care so that health professionals involved can more easily communicate with each other, work productively as teams, bring together the services to support the people who need cancer care. Technology can deliver improved access to specialist expertise for everyone, wherever and whenever they need it, whether it's MDTs, care coordinators, or specialists in real time. Real-time monitoring and powerful analytics can assist MDTs in delivering more proactive and targeted care, reducing inefficiencies and improving outcomes. And perhaps most exciting is the potential for system improvement and learning. By using a combination of analytics and improvement science, it is possible to create a cancer learning environment where care is consistently delivered to a high standard. Let's look at each of these areas in turn. No hospital is an island. Hospitals are part of an interconnected web of care stretching from the patient's home to the most specialist tertiary level service, and in Queensland across large geographical regions. Information technology offers opportunities to strengthen that web and deliver better connected care. Over 250 facilities are connected to over 65 data sources, creating a digitally enabled cancer ecosystem. In 2020, 33,000 people will be diagnosed with cancer in Queensland. The growing population of people with multiple conditions, many of whom are old and frail, makes effective coordination a challenge for cancer care. In addition, 30% of all cancer patients in Queensland access the two sectors simultaneously. So we need systems that can cut through these challenges, as without effective coordination, the experience of care can be poor and there is significant risk of duplication or neglect. Another point, health information about individual patients is frequently stored in a number of different and inaccessible silos across hospital systems. Even within a single provider, data can sit in different departmental systems. Our first radical move was to use digital technology to attack the harms that come from fragmented care by bringing together those silos. Over 65 discrete systems have been brought together from every corner of Queensland into the Queensland Oncology Repository. The Queensland Oncology Repository puts all this data through its paces, with over 3.25 billion pieces of information being standardised and deduplicated to create over 600,000 matched and linked records for the cancer population of the entire state. The second radical idea was to develop a secure web-based system that could consume all the rich data and deliver it to clinicians where they need it most. When systems meet clinical needs, they are much more likely to succeed, and so working with clinicians across Queensland who are committed to multidisciplinary care, COOL was born. COOL, a secure web-based system, integrates with the Queensland Oncology Repository and spans the entire state. COOL removes geographical barriers between data sources, health professionals and patients, ensuring relevant professionals have immediate access to clinical data anywhere, anytime. Over 800 health professionals and 67 teams use COOL to deliver multidisciplinary meetings, care coordination and inter-hospital communication, improving access to specialist expertise for everyone. As of today, over 200,000 patients have been captured in COOL, where health professionals then have access to MDT treatment planning and a lifelong record for each patient. It's reassuring for patients to know that those who support them can access the specialist advice and information wherever and whenever they need it to deliver that cancer care. As the data points are generated by each of the source systems, they flow into the repository. The summarised data points are then passed out to the systems and applications that sit over the repository and used in a variety of formats. As the MDT records their decision-making, for example, cancer stage, COOL is updated in real time and summarised, the data being available for the team to communicate to each other and also flowing back into the repository. This data then finds its way into COOL Dash. COOL Dash allows for the identification of variations in clinical practice, optimal care pathways, and benchmarking across MDTs and institutions, compared with statewide results. In this example, the team can compare their processes and surgical survival with the rest of Queensland. Real-time data that's available to them to assess their practice. With a focus on the rates of use of guidelines in addition to the health effects of the guidelines, this is implementation science working in practice. Teams can explore the data to better understand why they might vary from statewide averages or benchmarks. Perhaps they have an elderly population with multiple conditions affecting their post-operative mortality. These data can also be used locally to develop initiatives to improve evidence-based care and patient outcomes, or used at the statewide level. An example of a population-wide COOL project in Queensland is the Lung Cancer Staging Project, which collects data about tumour characteristics and the spread of disease. Using machine learning algorithms, the text in radiology reports is converted into staging information, a critical data resource for population-wide reporting on evidence-based guidelines for lung cancer. Examination of population-based guideline concordant care is now a reality in Queensland. These opportunities come together in the cancer learning environment, which is now woven into the digital cancer landscape across Queensland. Use of the cancer learning system has resulted in over 2,000 reports and publications reaching clinicians across the state, highlighting the benefits of some radical thinking over 10 years ago. The use of the COOL system has delivered large clinical registries, for example, in AYA cancer, with vast numbers of data points allowing for powerful analyses and providing services with new understandings and levers for quality improvement. As new technology explodes, the cancer learning environment is prepared and able to respond. For example, with the establishment of the first genomics MDT in Queensland. Grasping the opportunities we have described requires skills and capabilities at all levels of the digitally enabled organisation. The highly skilled team at Cancer Alliance Queensland, within a rigorous governance framework provided by the Quality Assurance Committee, are fundamental to this process. With expertise in analysis, statistics, software engineering, coding and clinician engagement, the Cancer Alliance Queensland team support clinical teams and multidisciplinary meetings with the data, systems, tools and expertise to drive improvement. Feeding the learning from clinical and non-clinical data back into existing processes is essential to fully realising the benefits of digital technology. Often a gap for most systems, the COOL platform focuses on increasing the health system impact of evidence-based practices, and through scientific rigour contributes foundational knowledge to the field of implementation science, which can have impact well beyond cancer-specific services. We have laid out the path taken in Queensland to acquiring maturity as a digitally enabled cancer learning environment. This is a path that reflects not only the expectations of patients and clinicians that we provide clinically excellent cancer services, but that we can also monitor those services to assess how we are delivering that care. It is an ongoing journey rather than a one-off assessment in pursuit of excellence.